Honourable members, let's get the rules clear. I called for the notes to be clear. 3 questions clear. If there's a need for follow-up, it should be from the answers. That's why I'm stopping the Chief Whip from asking another question. Yes, Honourable Samson.
Thank you very much, Mr. Chairman. Mr. Chairman, in one of the broadcasts to the nation by the President with regards to COVID-19, he said the President promised that his government was going to construct 88 district hospitals. And then on July, when the President met the chiefs and elders from Bolgatanga and Bongo and Talensi, the President was specific that those 88 hospitals was going to commence in July 2020. We are in February 2021. Can you tell this committee how many of those 88 hospitals have been built so far? And where, if you can mention those districts to us.
Thank you, Honorable Chair. That was the President's vision, which was supposed to have been translated into action. Seriously, the President set machinery in motion. He set up a committee in the presidency, chaired by the Chief of Staff. I was a member. We pulled 1 or 2 infrastructure directors from my ministry, Ghana Health Service. There's also a fair representation on that. What they asked us to do immediately was to write to district directors for health services. The local government minister was to write to all these assemblies for them to allocate land and give us the site plans of where they wanted these districts hospitals to be sited. As I speak, we still have close to about 13 districts that have not completed that exercise. Some of the districts, after they got the initial responses, there was a team that was set up. A coordinator has actually been appointed to coordinate this because the work volume is so huge, such that added on to our ministry's work in the midst of COVID would have meant that we wouldn't move at all. So they sent teams into various zones of the country that have been divided by the coordinator and the team that is working on these 88 hospitals. Some of them have litigation matters, and so we have to find a way to settle them. We are still working on these, and contracts have been awarded, and we are waiting to do proper shortcutting for all these things, actual construction to start. The preliminary works have actually been done. We are not waiting for the ones that have been submitted and finished with land issues, but we've started working on them. We face challenges in the midst of COVID. Things were not moving the way things should have gone. And that is why you will see we might not have started serious work on any of them. But our target was to have at least reached length level by close of the year. Unfortunately, we couldn't get there, but we are working seriously on this matter.
Mr. Chairman, this is a follow-up. Nominee said that what the President said was his vision. But I've said to you that in July, the President was specific that the project was going to commence in July. So how can commencement now becomes a vision?
Honorable Chair, what I said was that President vision that should have been translated into action. And that translation gave us a roadmap. And that is how come the President said we'll start in July.
Mr. Chairman, thank you very much. Can you tell this committee how much it will cost to construct one district hospital and the total cost for the 88 districts?
Mr. Chair, the initial costing was done on the basis of averages. And we're looking at between $5 million to $7 million per hospital. On the issue of equipment and other logistics came in, other equipment came in, we were still thinking that a maximum $7 million could do what we should do. If you multiply this by 88, and the 88 has even changed to 111, we're adding on regional hospitals for regions that do not have regional hospitals, especially the 6 new ones, plus the Western region, the Northwest, Southwest region. And then we are also rehabilitating Ifeanyi Hospital. This, together with other places that we left out when we're counting these other hospitals, 88, have brought this number to a total of 111 at the moment. That is what we are working on. If you look at the minimum 5 million and the maximum 7 million multiplied by the numbers that I've mentioned, take away the regional hospitals because they may come at a different cost. This is what it is. When the team went round, topography of land and all that is indicating that prices might not be uniform across the country. In some places, there may be some escalations. In some places, it might be probably lower. So we are still computing, and unfortunately at this stage, I can tell you exactly how much the total will be. It will just be an estimate of what I've said. 5 times 111 minimum, 7 times 111 minimum. That is what I can say, Honorable Chair, for the question.
Chairman, just a follow-up. So if I did a little arithmetic, 7 times 101, do you have that on budget? Is it budgeted for? Or will it be budgeted for?
Mr. Chair, definitely without a budget, we cannot utilize the money. And this question, I think finance will be able to actually put in. To the best of my knowledge, there is a provision, and finance has assured health that they are sourcing and have achieved some portion of sources that will do the work. So I wouldn't be the most appropriate person to answer this budgetary question, Honorable Chair.
Yes, Honorable Secretary.
Thank you, Mr. Chairman. Mr. Chairman, now that the COVID situation is becoming alarming and the affected numbers is increasing, the minister is aware that there are some regions that do not have ICU facilities as we speak. What are you doing to ensure that those regions, when they need that services, they will be able to get it? Because I know that Western North, for instance, don't have ICU, OT region don't have, Half region don't have, but they are supposed to benefit or enjoy such facilities. In the absence of ICU, what are the immediate steps you are taking to ensure that those people are catered for?
Honorable Chair, at the onset of COVID onslaught in the country around March last year, the first instructions went from Ghana Health Service and the ministry to all these hospitals to create spaces to fight the COVID battle. Honestly, these hospitals have never had intensive care units to the level that can take care of COVID, severe and critical COVID patients. So we kept on referring to the regional and how do I call it, the teaching hospitals. In the midst of that, after having evaluated the inadequate infrastructure in our facilities, we earmarked about 12 places where we set out ourselves to actually begin to construct treatment centers very quickly for us to be able to put in things to do the type of work my honorable colleague is asking about. Places like Zebila, Goso, Sefi also, I think somewhere in Soy also. The Dudua one is fully completed. Several places that we earmarked. Fortunately, the monies that were supposed to have utilized through the World Bank thing almost all went into procurement of PPEs, sanitizers, and face masks, and gumboots, and caps, and gowns for the doctors and all that. So the project halted a little bit. It is only now that the second tranche of the World Bank support is giving us room to actually advance monies. We ask the contractors to pre-finance and we will come on. And I believe by close of this year, all these treatment centers will have been completed. But we continue to rely on our referral systems to try to see how best we can solve the problem. Luckily for us, the enhancement of the ambulance service with 307 ambulances, one for each district, seem to be supporting us a little bit, and we keep on getting patients referred in ambulances coming close to where we have these facilities. That is what I can say in respect of this question, Honorable Chair.
Thank you very much, Honorable Samsahi. Yes. Is that a member for the... Okay.
Is to strike. What do you suggest we should be doing now in readiness to
That is a very big priority on the agenda if, Honorable Chair, you and your colleagues give me the nod. Something that we're going to tackle seriously to get a fully established CDC. And all I'll have to do is to do some more stakeholder engagement. I'll bring it even here to the committee for engagement, and we will look at it, pass through cabinet, to come here for us to actually see it before it goes through. But I'm very committed that we will see a CDC established in the country before the end of the year. Thank you.
Mr. Chairman, one key problem in our country hospitals is the lack of beds, the no-bed syndromes. And I know that as Minister of Health, you have made a lot of efforts to address this problem. But unfortunately, this problem still exists in many hospitals across the country. If you are given the nod, what will you do to make sure that this problem is resolved?
Honorable Chair, we continue to invest into equipment into our facilities. Not very long ago, we were given some resources to have procured 10,000 hospital beds that we have distributed equitably across the country. Again, we are working on deploying e-health electronic systems that has a component that does bed management in the facilities. So that in the very large facilities, you might see some beds empty in one department, and then emergency will be full. So we can see through quickly, and reports from the system will give you an indication of how to resolve that matter. But in the meantime, we've given instructions. There are no facilities to turn anybody away on the basis of no bed syndrome. We should find a way to keep the patient, to stabilize the patient, before we begin to look at where we can conveniently transfer that patient to rest. So that is what we are doing. I believe that going forward, we'll continue to find resources to put in investments to help us resolve this matter.
Finally, Mr. Speaker, one of your key achievements as Minister of Health that you've been commended for is the introduction of innovation, drones, into our hospital services. I want to know from you how the deployment of this drone is impacting on our health systems.
Honorable Chair, one significant thing I may want to mention is the recent floods in Northeastern region after the Bagri Dam was opened, as even some parts of Upper East region. Because of the drones that we have installed, several places you couldn't reach. So we were flying essential medicines with the drones to these areas. Prior to that, you will have seen people carrying drugs and their vaccination fridges on motorbikes in water, crossing these rivers to reach Atlantis. But some parts of the country are now covered. We have installed 4 centers that is helping us do the work that we should do to reach people who are in very hard areas. Now, during the around October, I have been touring the country and looking at facilities and trying to motivate our health workers with my presence. There was a day we went to do a sword cutting for a chip compound to be done at Drobonso, the health center. Whilst there was a problem in there, and then they have ordered the drone to bring some oxytocin to try to support hemorrhaging in a woman in labor. And the drone came at a function where we had a function, dropped the thing, and the cheers that were coming from people there give an indication that the deployment of these drones have been very useful to this country. And as I speak, they are helping us with the immunization program, flying vaccines to areas where we can't easily reach. And I believe when we begin to do our COVID vaccination campaign, these drones will also be useful to fly some of these things. And their capacity, they even have cold chain storage capacity that will enhance our existing capacity to be able to store our vaccines in there. Thank you.
Just a little follow-up to Honorable Ejisu. Minister Designate, in your answer to his earlier question, you indicated your directive that no patient be turned away for lack of bed. You know that the doctors and nurses can carry patients even if there are no beds, and therefore it creates an obligation. Has it been brought to your attention that some COVID patients have no access to beds, and then there's critical shortage of oxygen for COVID patients in the country? And what are you doing about that?
Thank you very much. What I would say, in a pandemic of this nature, you will expect that the facilities we have would definitely not be adequate. Even in very developed systems like America and the US and Germany, this type of situation you are describing is found even there as I speak. We try to improve on the situation. Last 3 weeks or so, the new infectious disease center that we got support from the private sector fund to do for us, we linked the oxygen in the Ga East place to that. But when numbers began to rise up, we realized that that capacity couldn't do the 100 bed here and 130 bed here. So quickly we have to do emergency thing. And we have installed a new oxygen plant even in that area to work on it. As I speak, our engagement with USAID is bringing in a number of these oxygen plants to be sited. Yesterday, the memo I read through after engagement indicates where we have actually located some of them. We are saying that they should relocate them. WHO is giving us oxygen cylinders as we also strive to procure some more. And we are working very hard to try to see how best we can solve this problem. Now, the pandemic will give us some experience. And if we don't learn from this, and we continue to live our system the way the pandemic came to meet it, then it will not be a problem of only the health minister and only the current president, but posterity and all of us in the country. Thank you, Honorable Chair.
Yes, Honorable Okuje-Tabla.
Most grateful, Mr. Chairman. Mr. Chairman, I would want to begin by making a few preliminary observations. The nominee will have to help the committee with the accurate rendition of his name, because the communication from His Excellency the President, number 14, Minister for Health, Kweku Ajeman, is spelled with a J, Menu not hyphenated. Your CV has Ajeman without a G and is hyphenated. For our records, which one do we go with? The communication from the President or your CV?
My CV, Honorable Chair.
I hope, Mr. Chairman, that the presidency will reconcile these matters. The CV you have submitted to us this time around, I have cross-checked with what you submitted to us 4 years ago. And you may want to look at the Hansard of 27 January 2017. Quite a number of your dates and numbers do not quite add up. So you may want to reconcile that later. Matters to do with your basic education. 4 years ago, you told us 61 to 65. This year is 1960 to 1963. And all the way down to London School of Accountancies. The years are not matching. And you may want to reconcile that later, Mr. Chairman, if you permit the nominee. And if you also look at the face of your CV and the educational background, I do not think it's possible, F and G, that you were at the University of Ghana and at the London School of Accountancy at the same time, 1975 to 1978. I want to believe that is an error.
An error.
So, Mr. Chairman, I believe the nominee will tidy these matters up so that we can have consistent records.
Can easily be corrected. 1988 to 1980, 85 to 1988, the London School of Accountancy.
And the page 2, you have the item numbered G and H, Deputy Minister, Ministry of Transport and Communication, 2001-2003. Deputy Minister, Ministry of Roads and Transport, 2001 to 2003.
Honorable Chair, I can explain that. The first reshuffle by President Kufuor took me into that situation. I was put in charge of Deputy Minister in charge of Transport. And the first reshuffle hived off Transport to join with Roads. So I was pushed with my Deputy Minister portfolio to join Roads. And that is how come I served in Roads and Transport.
Yeah, but I'm sure at different dates, isn't it? Because what you have here is 2001 to 2003, same period.
Same period. These two ministries.
Yeah, so these matters, in relation to the CV you presented to us 4 years ago, kindly have a look and let's clean them up.
Thank you.
I want to start with my substantive questions. I hold in my hands the Auditor General's report for your ministry from 2017 to 2019. This is particularly important because you have quite a strong reputation in this House. You were Vice Chairman of the Public Accounts Committee from 2009 to 2013, and became Chairman of the Public Accounts Committee from 2013 to 2017. And I recall those days, all of us as ministers, anytime we had to appear before you, it was quite a dreaded day. You were a very sharp chairman of the Public Accounts Committee, very intelligent, chartered accountant.
I would say.
And Oh, if you want to interrupt, you can go ahead.
I can't remember if my colleague actually appeared before my committee during those days.
I appeared on a number of occasions with my bosses, my ministers, as you recall. And you executed your mandate to the admiration of many as chair of the Public Accounts Committee. And I recall that when His Excellency the President first nominated you, he told the nation that the reason for the nomination was because of your financial prowess, that he hopes you help streamline the finances at the Ministry of Health. Now I look at your audit reports from 2017 to 2019. I have all three reports here. If you look at the verdict of the Auditor General, for example, at page 107 of the 2018 report, the Auditor General writes, "Our review of the mechanism in place at the Ministry in respect of the accounting for withholding taxes was not satisfactory." Was not satisfactory. The Auditor General report, if you do the tabulation, which I have done, beyond the frustrations the Auditor General has documented here. If you take the 2019 report, for example, at page 86, it says, "Our review of the mechanisms put in place at the Ministry in respect of the accounting for withholding taxes was not satisfactory," unquote. Paragraph 176, page 87, says, "To minimize the risk of abuse, we urged the Ministry to exercise strong control over the accounting processes to ensure compliance with the provisions of the income tax law." The Auditor General reports that we have lost in 2017 21 million.
Honorable, is that report laid before Parliament yet?
Yes, these have been presented to the House.
To the House.
These are my copies, yes.
Of what has been?
Yes.
Very well.
2017, we lost 21,396,685 cedis at the Ministry of Health. 2018, Ghana lost 23,142,246. 2019, we lost 18,489,433.86 cedis. A total of 63,028,364.86 Ghana cedis. A colossal amount, huge amount. As former chairman of the Public Accounts Committee, how do you respond to this, particularly in relation to a recent report I've been reading, captured, published online by the University of Michigan, Capacity of Intensive Care Units in Ghana? I'm sure you've seen that report, by Moses Sion Frimpong, Sumka Ruture, Nanasefa et al. And they say that...
And what is the question? Now you're moving from Auditor General's report to
it's
intensive care unit.
Yeah, Mr. Chairman, it's important, if I will be permitted, you'll get the nexus.
First.
You'll get the nexus, Mr. Chairman.
Can I control the proceedings, please? You asked him a question relating to the Auditor General's report. If you let him answer that, then he can follow up. But now you're lumping the two up, and the rest of us must follow you. Please.
But, Mr. Chairman, I'll follow your guidance. So, Auditor General's report, over 63 million cedis lost at your ministry. Former PAC chairman.
Mr. Chair, just like my colleague mentioned, I'm also very, very familiar with Auditor General's reports. And if you sit in the ministry as a minister, these type of misdemeanor challenges will only come to you after auditors have come to audit. They will then submit management reports. That is what comes to the minister's office, that this is what is happening under you. Can you do something about it? Now, even our Public Accounts Committee, the accountants are allowed space to try to rectify these anomalies. So if they find this anomaly against a ministry or an accountant, you won't have to go and rectify. We do something like implementation of auditors' recommendations. So I want to believe that by now, if Public Accounts Committee had interrogated this report, the withholding taxes that might not have been withheld, or those that might be withheld but have not been paid to the GRA, might all have been now implemented as recommendations that they should get through. So the initial recommendation will look like they have lost it. But if we're waiting for Public Accounts Committee to sit now, you realize that the ministry might have done something about it, and all these things might have been recovered or corrected. So for now, I wouldn't say we haven't taken a look at it. Any audit, management report that comes to me, we have an audit committee that interrogates this and try to rectify them. But this initial report that comes will give them space to correct anomalies. I may want to look at outstanding recommendations that have not been implemented. And that is where I will say I might have found myself faulty or I haven't done so well. So we may need to interrogate that other report to see whether they have worked on it or not. Thank you, Mr. Chair.
Mr. Chairman, by way of follow-up, these are audit reports from 2017. Can you be more specific as to what you have done? And I want to relate that to reports emerging that Ghana does not have adequate ICU beds. These 63 million cedis, you can use it to solve that problem. You can use it to buy ventilators. It can help us in our COVID fight. There are several regions in this country, if you look at this report, without a single ICU bed. Upper West region, Western region, Western North, Ahafu region, Bono region, Bono East region, OT region, Savannah region, Northeast region, Upper East region. Not a single ICU bed. And we have all these loopholes in the system. As a minister, what are you doing about it specifically?
Colleague, the question becomes a little bit more complex with linking. But all I want to say is the fact that the withholding tax for Minister of Health doesn't lie in our hands. It gets into a consolidated account if we pay to GRA. So there is no guarantee that that money will come to do this for us. Even if you have collected it, it may have been allocated to Minister of Foreign Affairs or Education or somewhere else. The bottom line is that
our interest is, could you have done something more to ensure that the money went into the appropriate accounts? That's what we're interested in.
Honorable Chair, yes, I have explained. The specific question he asked about these particular ones, to be difficult for me to answer because there are several infractions that we deal with when it comes to audit reports. And for you to pick just one or two items to come up with, I can't offhand remember what has been done about it now. But our audit committee is composed of even people from outside the ministry who admonish the accountants who work on it, not only the minister. And I want to believe that going forward with my presence in that ministry, some of these things will see some improvement, enhancement in them. I can't hold brief for directors and accountants who are working, but when these things come up, what I do as a minister or a supervisor, I do try to correct some of them. When I joined, audit queries from Global Fund and other Gavi and all that has reduced. A lot of them have actually reduced. And I'll continue monitoring and make sure that all recommendations from auditors' reports are seriously recommended in the ministry. Honorable Chair, thank you.
Thank you, Mr. Chairman. Mr. Chairman will be counting on his expertise and experience in that regard. The second issue I want to focus on, Mr. Chairman, is the matter relating to the arrangement you put in place at the airport ahead of the reopening of the airport on the 1st of September, what I call the exorbitant $150 charge per antigen test. Can you tell us how the company known as Frontiers Healthcare Services Limited came to be given that contract to carry out the antigen test and how you also came by the amount of $150.
Thank you, Honorable Chair. Honorable Chair, it will be very difficult for me to answer this particular question. Why? Because there's a presidential task force that is supporting the ministry to do the COVID battle. This particular arrangement was put in place by the task force that reports to the president. Now, they actually did the procurement for the, how do I call it?
Sorry, Chairman, just Minister, whilst you're London, is the Presidential Task Force a procurement entity under Ghana's procurement laws? We need further details, but we're happy to hear you further. Thank you, Chair.
Please, in the midst of the pandemic, I would say this wasn't an anomaly. We had groups that were doing various things. And for the task force to partner with a private sector person to do what we did, knowing very well that the ministry itself didn't have the capacity to do and install the type of equipment they put there, I think was quite normal as an emergency arrangement to have done that.
Chairman, just to take note that we would be requesting the chairman of the Presidential Task Force to be in attendance to give evidence to this committee as a witness to testify to what the minister is submitting before your committee.
Well, that's your suggestion. We can discuss later. Kindly continue, please.
By way of follow-up, are you aware that the company Frontiers Healthcare Services Limited, by registration number from the certificate of incorporation I have here, CS1140922020, was only incorporated on 21st July 2020, a few weeks to the reopening of the airport, and it had no medical laboratory experience? Are you aware?
I would say I'm not aware.
Are you also aware that
Honorable Okujeta Blakwa, you exceeded your limit by about 6 questions.
Not at all, not at all, Mr. Chairman, not at all. Not at
all. Honorable member, you had about 5 minutes to talk about CVs. I ignored that. Then you have asked 3 questions. Now you've done follow-up. So you've way exceeded your limit.
Mr. Chairman, I conclude on Frontiers. The Fees and Charges Act, you're a senior member of this House, requires that the $150 should have been brought to this House for approval. It wasn't brought to this House. The Health Institutions and Facilities Act 2011, Act 829, requires, under the first schedule, section 11.2, that clinical and biomedical laboratories must be licensed before they operate. When they started operating on the 1st of September, I have obtained the certificate from the Health Institutions, Health Facilities Regulatory Agency, known as HEFRA. They only licensed them on the 3rd of November 2020. So by the time they were operating at the airport, human lives were at stake. They had not been licensed. Minister of Health, are you aware of these clear infractions of our laws?
Honorable Chair, in the pandemic, we had a phrase we were using that we were not in normal times. There were certain things that we had to do and try to rectify as we go forward because of the urgency of what we should do immediately. This licensing was done even on my insistence when I went around to do the checks and find out that this hasn't been done. And I said, no, quickly, let us go and rectify the anomaly before things get worse. So when people are dying and people are flying and people want to visit wives and husbands and they can't go, and we needed to open the airports, and we had to put in place something immediately for them to be able to be screened. to try to stop importation of the virus into our country. Honorable Chair, I must admit that some things might have done.
Couldn't Noguchi have done that?
You know, normal instance. And that is why we have this. Honorable Chair.
Thank you. Yes.
He's asking another question. Couldn't Noguchi have done that?
Honorable, I didn't admit that question. Yes. Now I'll move to the. Yes.
No comment.
Yes. Patrick Bama raised his hand. Yes.
Thank you very much, Chairman. Congratulations, Honorable Minister Designate. Honorable Minister, I have in my hands the Public Health Act, and Part 2 deals with vaccination. Recently, the President announced to the country the strategies he has in place to help Ghanaians get vaccinated with this COVID-19 pandemic that we are facing as a country. And Part 2 of the Public Health Act mandates, Honorable Minister, mandates you to appoint other registered medical or veterinary officers and other persons certified by a senior medical officer with the necessary competence, skill, and knowledge to be able to assist a public vaccinator. You have public vaccinations, compulsory vaccinations, vaccination of adults, and what have you. What strategies have you put in place should we procure these vaccines to get Ghanaians prepared and other certified vaccinators in place to be able to go around and administer the vaccines professionally as stipulated under the Public Health Act? Thank you.
Thank you, Honorable Chair. Honorable Chair, I must mention that one thing Ghanaians should be proud of is the fact that we have a very robust expanded immunization program that sits within the Ghana Health Service. It has a structure that reaches everywhere in this country. As I speak, our traditional vaccinations in terms of polios, DPTs, and all that, by WHO assessment, we are doing 95%. We started developing a vaccine strategy for COVID vaccinations. We thought it wisely not to reinvent any wheel, but continue to rely on what is good for us. So if you look at the strategy when it's fully completed and confirmed, you will see that we're using Ghana Health Service infrastructure to actually do the vaccinations when COVID comes. We've started training those who are doing vaccinations, especially for even COVID, so that immediately we get how do I call it, the stocks. We can move in quickly to do our vaccination.
Chair, as a follow-up to that question, I understand that some of these vaccines ought to be...
I'm afraid we don't have such ultra-negative cold chain equipment, but we have cold chain equipment that can take some types of the vaccines that we are looking for. The indications we are getting, the first vaccines that we may get with AstraZeneca, that can be stored in our current or existing cold chain infrastructure to do the work I want to do. One other one that is coming up, Johnson & Johnson, if you're able to even get stocks from that end, that can be stored under normal room temperature, so we might not have so much challenges. We do have limited capacity for those ultra negative cold chain facilities, some limited facility. If you should get some quantities, we can store them in Accra and Kumasi, for example, and use. We don't carry them across the country where we don't have any place of such nature. Thank you.
Chairman, my second question is on our party's manifesto, page 157. the New Patriotic Party, the ruling party. 156 to 157 lists about 13 focal points that government wants to achieve under the second term of the president. And it includes, but not limited to, focusing on telemedicine to enhance health delivery. Can you address us on how you intend to pursue this vision of the president and the party and government? Thank you.
Thank you very much. Honorable Chair, we started working on telemedicine. We have a small committee in Ghana Health Service that is engaging to look at infrastructure and training and what have you to actually get infrastructure to do telemedicine. So there is a program in place to enable us achieve this manifesto pledge, and I believe going forward we'll enhance our activities in there and speed it up and make sure that we're able to position ourselves to do.
Thank you. Last question is on the same Public Health Act, on advertisement. And I'll tie it in with traditional medicine. We've seen that the FDA has taken steps and has been clamping down on manufacturers of non-certified or licensed products. Some included QRFS and others. What are some of the challenges that you think these traditional health manufacturers of these products are facing, and that you, when approved, could be of help to assist them in this regard? Because I believe it's a big industry that the ministry ought to look at critically. Thank you.
Honorable Chair, if you look at the manifesto, one of the things is try to promote traditional medicine. They have an association, a very large one they call GAFTRAM, and we meet with them quite frequently to try to encourage them to register their products with FDA. To register, there are two things that they need to find out from whatever concoction, whatever medicine you present to them. First of all, the Center for Plant Medicine Research will have to test for toxicity, such that you don't put in organisms or toxins that can cause other diseases to people who take your medicine. Then after that, FDA will certify for safety. And if you go through these two processes, then they give you a license to market your product with a shelf life that will give expiry and all that. So when they register you for this, FDA has got a surveillance unit that goes around the markets to try to check registered products and non-registered products. If they find non-registered products, they will want to take them off shelf and probably even prosecute the corporate who is doing that. If they find that you are selling expired medication, not only traditional medicines, but even the ones imported from elsewhere, right? They will clamp down on you. And that is the way for FDA, and I believe that is happening. And therefore, we wouldn't discriminate against traditional medicine people and the orthodox medicine people. So far as you are doing expired, you are doing products that are not registered, they will clamp you on. We are encouraging them, we are educating them, we are facilitating them to get their friends to FDA and plant medicine research for these particular tests to be done and approved, certified.
Yes, all right. Yes, Honorable Member for Tamale North.
Well, thank you very much, Mr. Chair. I wish to exercise my opportunity of a follow-up of two by starting with the use of one of those, Mr. Chairman, if you will oblige.
The use of what?
The use of one of the two follow-ups that I may have to.
Honorable Member, your follow-up should be after an answer to a question. So go ahead. If an answer requires that you follow up, I will not object to it. Please go ahead.
Mr. Chairman, I thought it relates to an answer given and not an answer given to necessarily my question.
Well, as long as you stay within the agreed rules,
All right.
you're clean.
Thank you. So it relates to a question that the Honorable Samuel Okudzeto Ablakwa asked, which has to do with the charges at the airport. Mr. Chairman, is a nominee telling this honorable committee and the people of Ghana that as minister responsible for the ministry, because he's a former minister of health at the time, because we were in abnormal times, he acted negligently and overlooked infractions of the law and even assisted a company that was fraudulently operating at the Kotoka International Airport, because the minister said...
Honorable Member for Tamale North, can you ask your questions, move out the imputations of crime, and you know those are not admissible questions. Let's not argue about this any longer. Please ask your questions straight. Leave out those imputations.
Okay, I take out fraudulently, but the minister said that it was operating without license at the time, and he assisted the company to get or advise the company that was supposed to have been operating with a license to get a license. Now, is the minister saying that because we're in abnormal times, like I said, he negligently allowed and tolerated and supervised the infractions of our laws, even though we have experienced companies that could have done the job that is being done at the airport, where Ghanaians and other citizens are paying $150, which, by the way, has been said to be exorbitant.
So what's the question?
The question
we have listened to your commentary. Now ask the question.
No, maybe if you had listened carefully, you would have noticed the question. It wasn't just a commentary. Is the minister telling this honorable house? That's how I started. That's a question. Is the minister telling this honorable committee and the people of Ghana that because we were in abnormal times, he acted negligently as Minister of Health and allowed the infractions of law and in some cases, assisted or advised a company that was not operating within the law to go ahead? That's the question, Mr. Chairman. Thank you. With all due respect.
Yes, Honorable Minister, were you negligent in your duties?
Mr. Chairman, my simple answer is no.
Mr. Chairman, the honorable nominee was on radio and said, out of, I believe, frustration or exasperation, that he was tired and that the president is tired and that all those who have been working on the COVID team are tired. Mr. Speaker, based on his admission of being fatigued, how can he convince this committee and the people of Ghana, given the fact that COVID doesn't seem to be showing any signs of going away anytime soon, that he still has the energy to continue as Minister of Energy, given the admission that he's tired? I mean, the Minister of Health, sorry.
What I would say, I'll answer the last bit of his question first. That can I continue in a way? But I would say I have the privilege of having my wife here. So probably she can assist me answer that question. Ajwa, am I tied?
You're out of order.
Mr. Speaker, sorry, Mr. Chairman, the translation of what I said here is wrong. 100% wrong. I made this admonition at a function in my constituency, Domahinku, and I spoke in Bruno. So whoever translated it to English got it entirely wrong, and that is not what I meant. Thank you, Mr. Chair.
Is there anything you want to tell us relating to that
Chair,
matter?
Nana can say. Yes. He's alluding to what I said. Say, Nipa ensha mask. Yaho huyensa. Ye use sanitizer. Na ye jumano. President na, we are putting money. Ye dia ho de nyile guso. Nipa nso nya ye no montie. Mr. Chairman.
Minister, you know, I say.
So you can translate for me. Mr. Chair.
Napo. Chairman has
So
directed.
it's unfortunate that this has come up here. But that was not what I meant. I was trying to tell people that they should have sympathy on those of us who are fighting the battle and listen to the admonitions we were putting into a public domain to adhere and comply with the protocols. That was all. Then a journalist who may not have gone up to a level that he should have reported properly, put this in there. I got the opportunity. Yes, I confronted the man who did that. That why do you misquote me in the language that, I mean,
Yes, go ahead. I thought you were going to ask him questions.
I just wanted to, for him, if, with your permission, to look at those that I have marked and speak to them, Mr. Chairman.
Kindly ask him questions from the document.
The question is, I want him to tell us how he has met these assurances.
Kindly read out the assurances he gave. And
Okay,
then
thank
he
you.
will
So, on ongoing projects, he assured the committee that one of the first things he will do, if given the nod, will be to request for stock taking of all uncompleted projects and adopt the appropriate actions in respect of each of them. 2, on how he will make mental health services more accessible and efficient throughout the country, the nominee stated that since the Mental Health Act 2012 Act 846 is yet to be implemented, he will give serious attention to get the law and ensure it is fully implemented to improve mental health service delivery in the country. On improving access to healthcare, he proposed the creation of an exclusive list for the elderly to enable them access the healthcare services they require. He was optimistic, improving maternal health care. He was optimistic that we will be able to achieve our targets in maternal and infant health by the time the program that the ministry was running at the time is completed. He promised to bring a report to the House after his first year in office on the status of the program. These 4, Mr. Chairman, how he has performed on these 4.
Yes, Honorable Minister.
Thank you, Honorable Chair. I think I'll start with ongoing projects. Mr. Chair, I had a long list of projects that were ongoing when I inherited the ministry. Like he said, I took inventory of what was outstanding. And as I speak, the few ones that have not been completed, there is work ongoing on them. It included the phase 2 of the Tamale Teaching Hospital project. That has been completed and commissioned. Honorable Haruna will bear me out. Not only there, the long outstanding Eurojet project that has 7 hospitals. We have commissioned about 4 of them, and there's work ongoing in about 2 or 3 that has not been done. We've done and completed WA. We've commissioned Pifupraso. We've commissioned Nsoko. Now they are working seriously in Sewua and Konongo. We have commissioned TEPA. The CHIP compounds or health centers that President Mills started, 10 of them in Central Region. I supervised and signed more than 30 certificates on each to complete the projects. And remember, it was published when I went
did you do the stock taking?
Yes, why not? I did a stock taking. I don't think I have
you
the
can move
document
to
here.
the next one.
So I did a stock taking. I've completed virtually all of them. The ones that have not been completed, there is work ongoing on them. And I can mention specifically some of them that I can remember. Okay? Including even Bekwai. That was left there for years. Right? Yes.
No, please. When we say Bekwai, let's not bring comparisons.
Honorable colleague from Bodi, yours will soon come finish my question. We will give you a hospital. Don't worry. This one, I will assure you. So you can also write it now. No, it's only my colleague.
Yes,
Bodi.
please proceed.
Bodi is a very deprived area. We will see to Bodi. Now, the mental health. We have revised the policy. We've got a law in place. We have done the LI. And through that, we've managed to get some funding from DFID. That is giving them close to about £400,000 every year to begin to do mental health issues in the country. I've worked on that. Now, exclusive list of the elderly to take care of them. Honorable Chairman, honorable colleague from Bodi, I shouldn't even have mentioned this to us. So I've withdrawn. Let us put on record. So, Honorable Chair, with your indulgence, let this be on record that the assurance to Honorable colleague from Bodi has drawn.
Please, let's proceed.
So let me continue, Honorable Chair. We have started engaging in gerontology seriously in the ministry. We've just launched our HR policy, revised one, that is going to take specific care of the elderly. We are trying to fast track the training of some of our young people who are learning to become nurses, those especially with certificate grades, to do post-basic degree, diplomas in palliative care and geriatric care. That is where that will take care of the elderly.
Received using a completely new panel of evaluators. 3, the respondent's attention is drawn to the matter of pricing and ensuring the money is attained. Consequently, the respondent is advised to be mindful of the pricing submitted by other tenderers and to desist from entertaining excessive prices as guided by Section 28 of the Public 8A 2D of the Public Procurement Act 2003 at 663 as amended. Now, Mr. Chairman, I'd like to know from the nominee that what resulted in the PPA board having to step in to cancel this award, and if the nominee is minded to also speak to an assertion that he subsequently, through ministry, awarded a sole sourcing contract to one of these companies that were denied, that was disallowed from carrying out the contract. Thank you.
Yes, Honorable Minister.
Thank you, Mr. Chair. Mr. Chair, this was brought to my attention from the upon. Going forward, I will continue to use that same strategy and enhanced things. I do a lot of stakeholder engagement. I meet with them quite often. We chat together, and I get their problems to be resolved. Assurances that you're asking me to give will be very difficult for me, Honorable Chair, because all that you do will have to be done with the approval of Minister of Finance, and they will have to consider their, indicators and their budget caps and things like that. So it will be difficult for me. But I believe I'll continue to fight for what will be good to satisfy the health workers that I work with, such that we continue to have a very congenial labor atmosphere within the sector. Thank you.
Mr. Chair, there is an age-old challenge confronting the health sector of the country, specifically to do with doctor-patient ratio. Over the years, we've been we haven't been successful at attaining the World Health Organization, WHO recommendation of 1 doctor, 1:1,320. At the moment, we are at an alarming ratio of 1 to 10,450. What policy framework, as Minister for Health, should you be approved by this committee and subsequently by plenary, would you implement in the medium term and in the long term to be able to achieve optimum levels of doctor-patient ratio in Ghana?
Thank you, Honorable Chair. The only strategy is accelerated training and facilitation of young doctors, medical officers, to go for training. In the meantime, over the last 4 years or so, we have introduced free postgraduate training for all medical officers in our country. So those who get admission to go to the college, the government pays for their fees. And that is enhancing them to come to specialize before they qualify to go to the fields to work. Again, when I talk about selected training, schools are getting expansions to intake more students to do medicine. There's a policy that allows accreditation for private sector facilities to also train doctors using public clinics in partnership to train them. Again, government hasn't stopped sending young graduates outside to also train to come back as doctors to help our system. So these are strategies that we are using to try to see if we can, within a very short, medium term, cut down this type of racial inequity, imbalance to help our system. Thank you, Mr. Chair.
No, Honorable Member for Medina, is that right?
Thank you very much, Mr. Chair. I want to use the opportunity to congratulate the nominee for his re-nomination for the position. And talking about the labor front and then manpower, my colleague just made reference to doctor-patient ratio. I am aware that as we speak now, we still have about some 580 qualified medical doctors, new medical doctors, who are yet to be posted or absorbed into the system. What would you do in the shortest possible time, if you have the note, to ensure that these doctors are absorbed into the system?
Thank you very much. I'm a bit surprised at the numbers my colleague is giving me now, and I'll quickly check on this if it is correct. Because over the last 2 years, we have changed our system to avoid young doctors staying home for any period of time before they get posted. Fortunately, we are getting financial clearance from Minister of Finance to the extent that even if it's a single doctor who has qualified and hasn't got in place, we will write to them and they'll quickly give us financial clearance to actually employ them. So I'll quickly check on this, whether we have got their financial clearance, whether their financial clearance is still in finance, and what is actually holding on their postings, and for how long they have stayed at home. When I do that, probably these things will be resolved as quickly as possible.
Mr. Chairman, the second question again is on labor-related matters. One of the institutions that has widely abused the use of contract workers, and there has been the Ghana Health Service. There are several numbers of workers across the country who are taken as contract workers, and contrary to Section 75 of the Labor Act, have these contracts renewed over the years, and some have served as much as 17 years, 16 years, and yet they still are casuals within that space. What would you do to mechanize these casual workers when given the nod?
Thank you, Honorable Chair. Honorable Chair, as early as 2017, when I was sworn in as the Minister for Health, I started that area and I wrote to all health facilities not to recruit contract workers, for us to engage to find out what. Like I said earlier, I went to the sense of humility and positioned myself to learn. So I was learning from the system at the time, even before I wrote that letter, because I realized that it was infringing on some aspects of our labor laws. The one I stayed on and they were tutoring me and I was learning very fast and I got the experience in it, I seemed to have agreed somewhat with what they had. They were not getting financial clearance in the past, prior to 2017, and they needed people to work, especially orderlies, people who are cleaning the hospitals, people who are washing, working the laundries, including even nurses and midwives. So we have to accelerate recruitment and see how best we can mechanize these people. They have been allowed by the guidelines of our internally generated funds in the facilities to pay such staff with what they generate internally. And I was a bit amazed. The IGF, they have approval from finance to utilize to do recruitment at the facility level. But that was also helping the system. So I couldn't sit there as a minister who understands and knows the laws and stop all these to break down a system. So I started engaging. And that is part of why we have been able to recruit close to about 90,000 people, in addition to those that we have mechanized. Over 90,000 people, yes, in the last 4 years. And we are still engaging with finance. We write, we do budgets, we put in the non-mechanized staff to try to mechanize them. I've had engagement with Ghana Health Service. Our strategy, initially, I was suggesting that why don't they even surrender the IGF and let us put it in the consolidated account so that we can mechanize them and get paid from there. We are still working on some of these mechanisms. We haven't come to a conclusion yet. But I believe over the next 3 or 4 years, if I get a note, some of these problems will be tackled a little bit more vigorously.
A follow-up. Very well.
Honorable Minister, I want us to be clear. Are we talking about casual workers or contract staff?
They are casual workers.
Casual. The question started from contract workers. That's what I want us to be sure.
No, these are technologies that are used interchangeably within the facilities. I want to believe that not 90,000 casuals, please. I said people, nurses and midwives and new administrators and new accountants and some mechanized, non-mechanized have been put there. That is
very well. Yes, you may continue.
Thank you, Mr. Chairman. Just a quick follow-up. Honorable Minister, would you be able to give this committee and the people of Ghana and all these people out there some time frame within which we can work this thing out? Because some of them have been basically exploited for several years.
I would say I have taken cognizance of this problem. But for me to sit here to give time frames, I don't control the issuance of financial clearance. So my ability to resolve the problem will depend on what time frames Minister of Finance will give us the room to be able to do the mechanization. So we are still working on that. It's work in progress. And for me to give time frames will be a little bit difficult for me.
Very well. Mr. Chairman, my third question is on mental health.
I think I will answer very simply, yes. It is under consideration. We are talking about it. But simply, I will say yes, I will consider. If the amendment of the law is what will solve the problem, I will so do. Instead of administrative instructions, I continuously give. So I'll consider that.
And just a quick follow-up, because I mentioned the Pantan Hospital. I don't know whether it has come to your notice that the mental health facility at Pantan has been heavily encroached. The space, the government space, government lands around the hospital have been heavily encroached. If it has come to your attention, what is the ministry going to do about that? Because my understanding is that the staff and health have actually submitted several petitions to your office as a minister.
Honorable colleague, I'm very much aware of the encroachment in Pantan. We started even doing some fence walls in some very critical areas when we started rehabilitating the Ghana Health Service Training Facility and turning it into a treatment center, which is now being completed. We have awarded a contract for some fencing to be done, but not the entire stretch. At one stage, I asked one of my deputy ministers to go and contact the chief executive of the La Quantanine, this assembly, to stop issuing permits to those who are building in that area. My investigations indicated that the frontage of the facility was like somebody's land. Then I said it can never be true. Kwame Nkrumah will not establish this place, the former president, and leave the road in front of the hospital as somebody's land. So let us go to Road's ministry and find out the original site plan of Pantan Hospital to see if this part is not a road. Then the courts will grant, how do I call it, judgment to people and give them title to the land. So what we plan doing now is to try to do compulsory purchase. And we're engaging with finance to give us money. We send land valuation to do some cost estimation for us to try to see if we can find resources to do compulsory purchase and even pull down. The irony was that one of the buildings is so close to a mortuary in Pantan. Meanwhile, the person has built there. And every time you go there, they bring their people. At one stage, we were thinking that we send in the police and the military. And I said to them, don't let us do that. We don't have the law backing us to do that sort of thing. So let us respect the judgment that we have. So that has become a serious albatross on me. And I plan setting up a small committee in the ministry to look at not only Pantan, Tema, Cape Coast Teaching Hospital, the mental hospital even in Cape Coast. Their lands have been encroached. And we have to find something to protect these lands. I believe that will not be just the problem of only the health minister, but all of us, members of parliament and the Ghanaian citizenry alike, to protect what lands we have. The irony, again, is the fact that now there are some facilities even where you want to expand. There is no land for us to expand. We are looking for land to build a facility in Suame. We can't easily get. The facility at Kansawo, no doubt, never saw completion because of land. Medina, the East Hospital should have been in Medina. We couldn't get land. So the lands that we have, abandoned our facilities, should be seriously protected. And I think it's on my agenda to try to see what little efforts I can put in. But I will need your support, colleagues, and other well-meaning Ghanaians in the country to help us fight this encroachment battle. Thank you, Honorable Chair.
I sympathize with you. Largely, the problem is with the management of the facilities. People are taking it, they see it, they will not protect it. Sometimes they even colonize with them. Then you are sitting at the ministry, they'll bring the problem to you. Yes, Honorable Member for Abetifi. Yeah, Abetifi, yes.
Thank you, Honorable Chair, for the opportunity. And congratulations to Honorable Jimaimenu. Honorable Minister, on COVID, the numbers that are coming out, I'm sure as a management accountant, a chartered accountant, you see them every day. Do you have true faith and believe in the numbers that are coming out as COVID numbers for Ghana? Currently, 73,482 dead. Do you have true faith and believe in the numbers that are coming out? I do, but I want you to assure Ghanaians that the numbers that are coming out are accurate.
But I would say, if I don't, who else will? This is coming from our outfit, an agency that is dedicated to do this work. Then I sit on top of them as a minister and come and sit here, I don't believe in the numbers. Please, I do, and I do, and I do.
Thank you. The global mortality rate is about 2%. It is about, unfortunately, I cannot say fortunately
Sorry, Chairman, with the indulgence. The temptation for him to have said, fortunately, is the fact that he's comparing with global numbers. That is why. But not that he hasn't got sympathy for the dead. And honestly, if you watch CNN and BBC, you will be tempted to use the word fortunately.
Right, thank you. 2% is what that bring these numbers down, even though we are doing much better than the global average. What are you going to do to bring these numbers further down to save lives of our citizens?
Thank you very much. Honorable Chair, we have battled COVID for the past 10 or nearly 11 months. The strategies we have used, I would say, has worked somewhat for us in Ghana. If you look at our deaths, if you even look at infection rates, at a point where we slowed down transmission to this level, we must be thankful and grateful to God and our president for leading the battle. If you look at the globe, the same protocols and the same things that we are doing here are about the same things everybody is doing. Fortunately for us, we even seem to have no more than some even in America. Because when COVID started, what we started doing in Ghana, contact tracing to break the spread, some big people in America didn't even understand that. So we had moved. We are not going to change so much.
Chairman, so did you say these people or some people in America?
I said some people.
Okay, thank you.
Thank you. The Honorable Vice Chair has confused me a little bit with this intervention, right? The only new things that we are going to do are the new things that are coming up on the globe, the vaccinations. Apart from that, we are not beefing up our risk communication again. We've started even to try to make sure that Kenyans are there to the protocols. That is the only solution. But Kenyans, we are in the habit of blaming leadership, maybe the minister and the president, for not doing enough. We forget the fact that, I ask you, a family went indoors somewhere because of how do I call it, a birthday party indoors. We keep on telling people that wear face masks in taxis and trotros even when we ease up. And what we know is that when you are open air in the sun, transmissibility is not too huge, like sitting indoors and eating and drinking. So these are the challenges that we have, and I believe we should be encouraging people to adhere to the protocols as strictly as we can, and then keep distances and see how we can avoid it. The government is trying to bring in vaccines for us to vaccinate, but even that, after vaccination, first dose, you need about 28 days to do the second dose. Even after that, the nature of this disease is still not very known even to great scientists on the globe. We will still have to keep on wearing our masks. Even if
Chairman, Brian, I hope I have your excuse. The minister just said government is trying vaccines. When is the first vaccine in Ghana? We live on hope. And when can Ghanaians expect that they will have a shot of the vaccine? Thank you, Minister.
Honorable Chair, this is Parliament and House of Records. And I will be very circumspect. The indication that we have, those of us working in trying to bring in the vaccines, is between mid-February and early March. As for specific date that we are getting any vaccine, we still do not have any indication. The stocks on the globe.
Chairman, but there are dates in the first week of March. We need firm assurance for the Ghanaian people. Vaccine.
Very short period.
Okay, thank you.
Despite the president's efforts, talking to top people in Gavi, UNICEF, government bilateral levels, diplomatic high levels, there is not a single indication of a date. All they are saying is this period. So we are waiting for the period to come. all the necessary registration and orders and all that. We have done our quantification. We have developed our strategy to complete finally. But even because of the date, as to the exact particular day that we will start our mobilization, all we are doing is preparedness. Say that if you come tomorrow morning, we can get there.
So is there a procurement plan, and are you part of the procurement process?
I'm leading the procurement of the vaccine.
Thank you. Honorable nominee, you advise that the way to bring the numbers down is to adhere to the protocols. Meanwhile, in Ghana, the UN 2020 reports that 6 million. Adhering to the protocols requires wearing of masks, use of sanitizers. It costs money. Are you going to, when you get a nod, provide the poor with sanitizers, nose masks? They just can't afford it. Thank you.
I would say yes or no. When we identify the very poor who cannot afford, we will try and give them these masks. Honorable Champon, be very honest to the committee. You, during the campaign, where we were going around, we're not distributing masks to the poor. All of us, everybody tries to stretch our hand to go. The government, no, this was not a question, it's just a commentary. It's just a commentary.
It's all right.
Things that we are doing already as MPs, they come to your house, you give them masks. The government is pumping,
Honorable nominee, thank you very much. I recall saying this when we made a statement on the floor of the House, that we should congratulate ourselves for the support we have given the country in these matters. So we should continue. Yes, are you done?
Yeah, no, Mr. Nominee, final question. How many, we started your vetting at 10:30. I think it's almost 1, and we are still here. COVID times, how many hours would you advise that we stay here?
Honorable Chair, I was going to crave your indulgence to tell you what the scientists are saying across the globe. Now, we shouldn't stay indoors. We should try to avoid maximum 2 hours. That is it. You know, but because I was threatened a little bit with the fear factor, I couldn't admonish. So that is the rule. And if you take my advice, Honorable Chair, I think you have interrogated quite a lot, and we can close.
You remind me of saying the same thing 4 years ago, when after 2 hours you said, aren't we tired? We are not tired. Members of your leaders say you want to hear the lady's voice before they come back to you. Terrible. So, Honorable Mrs. Ejare.
Thank you very much, Mr. Speaker. Congratulations for your re-nomination to the Ministry of Health. Still accounting for your stewardship at the Ministry of Health, I refer you to page 34, paragraph G of the MPP Manifesto of 2016, where it was stated that all existing hospitals will be revamped and then new ones will be constructed where there are none. In Techman North, where I come from, there is no district hospital. And from 2017 to 2021 January, when you were Minister for Health, there was no sign of you in respect of a district hospital. And I also want to know what happened to the rest of the about 260 districts. Thank you very much.
Honorable Chair, I was trying to refer to Bono East. Tubodom has been captured here. Luckily, I've got it easily as part of the 101 district facilities that is coming. So Tubodom will get a hospital. Your own, I will not withdraw that one because I have seen it here. Okay. Now, let me admonish. My passion for health is quite high. Left to me, every little corner of this country should have access. Why? Because I'm part of those who are championing universal health coverage. Our president, together with 2 other presidents, actually calls the action plan to achieve that to be done. We have finished our roadmap, and I'm very taking affairs with my directors who are working on this. But you see, when you are sitting in a system like ours, without so much resources, and the finance minister will have to distribute resources to education and to roads and to everywhere, what is given to health cannot do the type of things we said we will do all of a sudden at a go. So it's a gradual process. Over the last 4 years, I believe you will appreciate the type of investments that went into health, apart from COVID, even health infrastructure, how we managed to complete the projects that were started by our predecessors, the type of new things that we plan doing. And I believe going forward gradually, this type of pledge will be fully met. Thank you.
Okay. Mr. Speaker, as a follow-up to this one, how sure are we that these same reasons will not be given for your inability to do the same in these 4 years when you are given the nod?
This assurance will be very difficult for me to come up with. If you are lucky to drill more wells and prices of oil goes up that high and the allocation to health investments becomes big, maybe yes, but for now, it will be very, very difficult for me to tread into the unknown. Thank you, Mr. Chair.
Thank you very much. My next question is on the La Osu Teshi Nungwa Hospital. My information is that it's been pulled down, and it was pulled down last year, and one was supposed to be constructed in earnest. There is an amount of money, about 68 million euro involved. Can you also update Ghanaians on the status of that?
I haven't been to the site for the last 2 or 3 months, but what I know, we passed through Parliament and money has been secured. If there are problems, there may be administrative hiccups, but I will follow up to see when I get a note how quickly that will spring up. But I know they started work there before even Christmas. Thank you.
Yes.
Yes. As the chief advisor to the president in matters of health, what is your advice to him in respect of the schools that has reopened, COVID, and lack of PPEs?
To the best of my knowledge, we have supplied PPEs to all education districts in this country. We awarded contracts a bit late, but as I speak, the report I have is that over 85% of supplies have moved. Liquid soaps, sanitizers, the face masks that we saw in country have all gone. What delayed some of them were the kindergarten type face masks for the very, very toddlers and kids that were in zone very quickly. But they have started shipping all that. The military is supporting us with distribution of the logistics, but things are moving gradually to all the districts in this country. They give us a distribution list that we are submitting and sending all these things to.
Thank you very much.
I have one more.
Oh, I thought you have had 3 questions.
No, 2.
Yes, go ahead.
So I'll do a last one. And this last one will be in respect of rapid test kits for testing coronavirus. I'm also told that the application of the FDA for approval for some of the rapid test kits to be used on the market. Are you aware of that? And then what steps are you taking to ensure that they go through the protocols as quickly as possible so that we could have as many rapid test kits on the market as possible to help reduce this menace called COVID?
Earlier on, the scientists didn't want us to use these rapid test kits at all for COVID testing. So we are all relying on PCR testing all the time. In view of that, FDA set very stringent and very high standards to pass through because they thought that the rapid test kits were not very, very efficient in detecting the positivity of the virus in any human being. Now, FDA has registered 2 of these products, and they are still taking, samples to continue testing. The 2 will soon be mobilized. They are now developing guidelines for it, And I believe by close of next week, Professor Ampofu's outfit, who is heading the laboratory testing group, will come out to the guidelines for us to utilize. So 2 have been approved, and I believe soon it will come on board in the country.
Thank you.
Yes, no, from majority I have to go to minority, I'll go to majority. Yes, Hassan.
Thank you very much, Mr. Chairman. I want to congratulate the Honorable Minister for Health Designate on your nomination. Honorable Minister Designate, you agree with me that every now and again, health professionals posted to the rural areas would normally request for transfer to areas where there are better amenities and facilities. I believe that there's a way that we can retain them in the rural areas. Do you have any plans for us to be able to retain the health professionals in Gushegu, the rural part of Gushegu, for instance, so that they don't even have to come and then work in Gushegu, but they can go to Nahuhogu or Navule or any other place, for instance?
In Gushegu Township, we sent some nurses there who had come back, they wouldn't stay in Gushegu. It's a problem. An old age one, I think we've mentioned it even here this morning. It is always on our plan. We are trying to package incentives to actually push people in there. But again, like I said earlier on, we can also assist. One of our colleagues has actually taken on board 2 doctors, a young man and a wife. He has facilitated them to get a vehicle so that they will stay in his constituency to work. These are little support probably we can also give to help us move doctors into our areas. So we are working on that, and we are a comprehensive package with cabinet approval, supported with funding, and I believe that can do the trick for us. They started it some time back by collapse because the identification of deprived communities. All of a sudden, everywhere is a deprived place, and the whole thing collapsed, just like the additional duty hours allowance that was abused and collapsed. So we're working on it, and this time we want a very robust package that will live the test of time. Thank you.
Thank you very much, Mr. Chairman. What, in your estimation, can you say are your 3 the topmost success story as a Minister for Health in the last 4 years?
Honorable Chair, this is self-assessment, and I wouldn't go far. I normally don't keep my achievements in there because it would be like you have an ego and you're boasting of what you have achieved. You know, but so colleagues, you can help me. You've mentioned the serene labor environment within the health sector. I think that is a huge achievement. COVID management is another huge achievement. The drone technology, the introduction of specialist training allowances, that is for free now. The health training allowances for free, not only Sankore, everywhere, you know, including Tamale and everywhere. So there are a lot of them.
Bekwai Hospital,
I think
number 1.
The construction of Bekwai Hospital. Thank you, Mr. Chair. Not only there, even the awarding of the 44-year-old Konfanochi maternity block. You know, 44 years. And the completion of the, what is Honorable Atufosin is not here, his hospital. I completed it. And when we went there, his young men pelted stones at the health minister. They said, what is this crime? Your hospital has been started. I've come to complete it. We are coming to commission. You are driving me away. But my friend patted my shoulder and said, don't worry. You know, the one in President Mills's place, Ekumfi, 5 in Greater Accra, several of these. So I wouldn't say I have failed, but I don't want to boast. I have achieved a lot in the health sector. Thank you. Where?
Please ignore him.
For not giving
Honorable, please ignore him. Yes, your last question.
Mr. Chairman, I think that this will be my last question. You alluded to the fact that at some points in time you tested positive, and then you took it, in your good stead, announced to the Ghanaian people, and went through the treatment regime. Now, we have been told in recent times by the experts that males suffer from some amount of, erectile dysfunction. Can you confirm whether that is the case? As a minister for health, you have a responsibility to educate Ghanaians.
I said don't answer that one.
Luckily for me, my wife is here.
Mr. Chairman, Mr. Chairman, this is a matter that I believe Honorable Napo and Honorable Esla have been arguing very strongly about. And I think he can settle that for us.
You are out of order. Very well. But, I'm sure the public want to know the science behind those things. Sometimes some of the things on social media are not generally.
As a doctor, one thing that we've observed is that COVID attacks all parts of the body, from the brain to the toe. So any part that is necessarily weak in that person will get worse. Who else? So that is the ball point. So some people, they are COVID when they started having it. I started not with body aches or something. I started with stomach runs because I have a very temperamental stomach. So it depends. Some start with a lung problem, some start with headaches, some start with bad body aches and things like that. But it attacks, because it attacks the blood vessels and the blood cells. So everywhere where you are weak, it will make it worse.
Thank you very much. Thank you. Eric.
Thank you very much, Mr. Chairman. Honorable nominee, I would like to take you back to an issue I think you did not adequately address. Can you share with the committee the processes that led to the selection of the unlicensed company to do the COVID testing at the airport, and whose mistake occasioned that unfortunate situation?
Mr. Chair, I could have answered adequately this question.
No, Honorable Eric, he answered that he was not responsible. The Presidential Task Force, and we'll make some requests in that respect. So if you have another question, kindly.
Thank you very much. The second question has to do with the fact that there is a strong relationship between health infrastructure and healthcare delivery. And looking at the huge infrastructural deficit that confronts us as a nation, one would expect that we will marshal our resources in an attempt to close the gap. Honorable Minister, you have been in charge of the sector for the last 4 years. Can you indicate to the committee where in this country that your ministry started and completed the construction of one district hospital? One district hospital started and completed in the last 4 years.
Honorable Chair, the Aburi project is not fully completed yet, but it's close to about 90% complete. Now, I had challenges in the ministry initially. If you look at projects that have been started and left before I joined that ministry, it was very difficult for me to go fight for new money for new facilities when some had been abandoned and some had not been completed. So my strategy, as I showed the previous appointments committee when I came for vetting, was to try to complete the ones that have not been completed. So the first 2 or 3 years, my focus was in that area. And I must tell you, I'm very happy with my performance with abandoned projects and projects that had not been completed as I speak now. What we started came last year or so, 1.5 years, That is when, getting close to elections, you saw me commissioning and doing sword cutting and several things in health. So going forward now, you will see a few ones that will come up, like the Lawan, the Central Medical Stores, the
hold it. The Lawan, what's wrong with it? It's become a football park. So what assurance are you giving the people of Lawan in this committee, like General Hospital?
The contractor mobilized to site.
You see only the
even before Christmas
commissioning plaque. Just the.
What I'm saying, that since after Christmas, I haven't been to the site. They haven't done the site meeting to have brought me a report.
When you are confirmed, will you visit like General Hospital to monitor the progress of work since the president cut short for it?
Did you say I should go and do that? When I finish, that's okay, thank you very much. But honorable colleague, you know how I told the country to see health infrastructure. Me, I won't leave this fence sitting down without me going there. You know my work. I was in Tamale on several occasions before
Eric,
I completed.
Continue, Honorable Eric.
Thank you.
Honorable nominee, do you mean that in the last 4 years, you did not build one district hospital? Is that the meaning?
We did several CHIP compounds and health centers.
I think I was specific. I said district hospitals. Why are you talking about CHIP compounds? No, I asked, Mr. Chairman, I asked a specific question.
And I'm telling you what we did.
I'm talking about CHIP compounds.
And I'm telling you what we did.
Oh, okay. Then my next question has to do with the number of people you claimed you have recruited over the last 4 years. You just mentioned that you recruited 90,000 people in the last 4 years. Over 90,000. Okay. Now, Honorable, you are aware that when you recruit them, they must be paid. And therefore, the Finance Ministry, through the budget, will make provisions for the numbers and associated emoluments. When you look at the figures in the budget, it does not support the position you are articulating here. Because in 2017, the staff strength of the entire ministry, as contained in page 117 of the 2017 budget, was 103,699. In 2020, the number went to 128,016. So where did you get the 90,000 figure from? And who is paying them? The 2020 budget is for the whole 2020. You are talking about establishment, ceilings.
Honorable member, ask the question. Ignore their sides, please. Yes, Honorable Minister.
See, I didn't get the question very clearly.
Honorable Nominee, I'm saying that you just indicated to the committee that in the last 4 years, your ministry recruited 90,000 health workers. And I'm saying that when you recruit, the Ministry of Finance, through the budget, make provision to be able to pay them. So the numbers and the associated emoluments are available in the budget. And when you look at the figures, the number of people recruited is not even up to 30,000. So where did you, yes, the figures are here.
Honorable Chair, I will crave your indulgence.
So where did you get the 90,000 from?
I will crave your indulgence, Honorable Chair, to later lay before you a template and the financial clearance that finance has issued to support my claim. Thank you, Honorable Chair.
Yes, go on.
Mr. Chairman, can you give him some specific dates? Because this is a statement of fact. And I remember in response to one of the questions, he said, this is a house of record. And he doesn't want to, he wants to be circumspect.
Honorable Chair, as soon as tomorrow morning.
That I'm asking that question.
Honorable Chair, as soon as tomorrow morning.
Mr. Chairman, my last question has to do with the COVID fight. You have been at the forefront of the battle, and you should be able to tell this committee how much this country has expended on the fight against COVID so far.
Honorable Chair, again, this is a very difficult question for me. How much this country has spent will be very difficult for me to do. we did intersectoral sort of expenditures, including even the military and the police and finance and education.
Chairman, Minister, they don't provide. Our difficulty is that the handing over notes that has been given to Parliament through the clerk, we don't have the specific on MOH, Ministry of Health, as in the ministry. So help us, how much have you spent, ministry, as ministry?
You remember, initially, we got $100 million allocation to spend on COVID. All that had been exhausted. We have got another money that's just about to mature for us to utilize.
Chairman, how much?
That is about $120 million from the World Bank.
World Bank?
Yes.
Is it a loan or a grant?
It's a loan. But some of these funds, I believe the finance minister had actually presented before the House some summary of these COVID expenditures before now. And I was thinking that these things can be very much elucidated by the finance ministry instead of trying to take this away from the now learning medical officer who has
Don't you aspire in your heart to be finance minister?
Thank you. Pardon me?
In your heart, don't you aspire to be finance minister?
Is out of order.
Why, will you want to endow me as such? That you wait until probably the day you become president.
Honorable Minister, can you answer the questions and ignore their sides? Very well. Eric, you are done, right?
Mr. Chairman,
that was your last question, because I left the table.
I just want to seek clarity. Mr. Speaker, it's very important. Mr. Chairman, it's very, very important.
Yes, seek clarity.
I asked a question about recruitment, and I supported the issue with figures from the budget, which is in the bosom of Parliament. Now, the honorable member is talking about templates. What has template got to do with the budget figures I'm providing?
However, when he brings you what he has, then you compare. Well, right. Honorable member, can I move on? Yes. No more questions from here. Very well. Nee.
Thank you very much, Mr. Chairman. I want to first start with the issue of the medical laboratory policy, which has been on the shelf for some time now. Considering the pivotal role medical laboratory technicians play in the health industry, particularly in this time of COVID, what assurances are we having, and how are you going to, what roadmap will you be giving us to ensure that that policy becomes a reality?
Honorable Chair, if my memory serves me right, and I'll stress, I'm not very, very sure, if my memory serves me right, we seem to have completed with that policy, yet to be launched. But I have to check on it to validate my own assertion. We have worked on it, but I believe we have completed and even got cabinet approval for it to be launched. So it's left with implementation. But I have to check on that assertion. I'm not very, very, very sure. But my memory serves me right, we have done it. If we haven't done it on my checks, Honorable, I'll give an assurance that we will soon complete with it.
Okay. Mr. Chairman, my second question. The importance of medical laboratory professionals has not been given any sort of, let me say, attention as compared to the other professionals. This derives from the fact that scholarship packages and things which are given to the other health professionals excludes medical laboratory scientists. what are we going to do to make sure that they are brought at par with other professionals within the health industry?
Honorable Chair, we've revised the organogram of the ministry, and we have created a division for medical laboratory scientists, and we've brought a director to sit in that area to ensure that medical laboratory scientists are not left behind in the work we do in the ministry. Thank you.
In an answer to a question on the disparity in the distribution of health professionals across the country, you didn't really seem to tell us how this can be controlled. Let me ask you, region by region, tell me, how many doctors are in Greater Accra? How many are in Ashanti? How many are in Upper West? The same with midwives, registered nurses, laboratory professionals, please.
Chair,
Yes,
this is a very, very difficult question. All I can say is that close about 82% of our doctors, are in Greater Accra and Ashanti region. This is all I can say for now. But if you want a very
these
elaborate
two
one,
regions
yes,
control or host 82% of all the doctors Ghana has trained.
Yes. So if my colleague wants a very detailed analysis the way he's talking, I will crave your indulgence to request him to vote for me to when they get to a note, and then I'll submit to Parliament for his, to satisfy his curiosity. Thank you.
Mr. Chairman, it is important, and I will want us to take note of this because we've been talking about this for long. But clearly we've not, the data has not been presented for Ghanaians to really appreciate the problems some parts of the country like Upper West and West are facing in terms of health professionals. And so I will want to hold the nominee to his word for him to provide that so that Parliament as an institution can take a decision on how we can
No
arrest
problem, Honorable Member. He says if it is approved, we'll ask that same question, and then he'll provide the data in Parliament so we can all, because actually these numbers are extremely unfair. It's extremely unfair, so but we should get the details and discuss them.
In an answer to a previous question, the Honourable Member told us that 111 proposed hospitals, district hospitals, at a cost of possibly 7 million. That would be taking us to close to almost 777 times the exchange rate today. We are talking almost about 45 trillion cedis. That is 4.5 billion Ghana cedis. Cedis. That's what I want to mean. 4.5 billion cedis today. Akoto akpei. Million. I want to ask you, let's be realistic. You have just said that there is always a priority areas like roads, social infrastructure and the rest, which compete with the demand of the Ministry of Health. Realistically, do you think we'll be able to get this money in order to make this promise of His Excellency the President become a reality within 4 years?
My simple answer is yes.
Very well. Yes, Agaga.
Congratulations, honorable nominee. I'd like to find out from you what informed government's decision to deploy critical care nurses to countries such as Barbados, Trinidad and Tobago in the midst of the COVID pandemic without taking steps to replace them at the various locations they hitherto were working?
Honorable Chair, there are one or two, let's say, a number of factors. What informed, I would say, part of bilateral relations for diplomacy. Just like we receive Chinese and other foreigners to come and support our health systems, I believe our president stretched his hand to also help other neighbors who needed some support. That is a significant thing. We took inventory of the type of nurses they needed, and we said to ourselves, we can let go some quantities that will not harm the system that we have. Again, the ministry itself, in our new HR policy, we are thinking of retraining some of our young people to even export them to help run the facilities and the type of human resources that we have. Mr. Chair, we have close to about 90 health training institutions that turn out close to 22,000 young people as nurses, certificates, and diploma students. We have to employ them into our system. If we continue that way for the next 5 years, our hospitals may be full with nurses that we don't need. As I sit here, when we're talking about doctor-patient ratio, we didn't talk about nurse-patient ratio. We have exceeded the WHO limits. Then I ask myself, can Finance Ministry continue to provide financial clearance? Can the budget soak it for the numbers that we train? So if you are talking about Ghana Beyond Aid, why don't we retrain to meet the demands of those outside so that we can probably support some of them to go and work outside and bring home foreign currency, just like the Filipinos do. It's a medium term. It's one of the things that we are trying to test to see how viable that can be, which is the reason why we tried to stretch our hands to Barbados. And there are demands. Immediately we finished the Barbados thing. Jamaica, Germany, Netherlands, UK, all of them are even coming. But we've held back because of the fear that we may deplete our resources unnecessarily until we train and retrain and we get larger numbers. That will make us export without causing any serious harm to our health system. Thank you, Honorable Chair.
Chairman, with your indulgence, are there shortages of nurses in some health institutions in Ghana?
I would say yes.
Why are you exporting what you lack?
Honorable Chair, I didn't pick him properly.
It says if you admit that there are shortage of nurses in some health facilities, why are you exporting some? Maybe he didn't listen to your explanation.
Because there are surpluses in some as well. So when these go and we try to readjust and realign, we'll still have the numbers.
Now I say, with the economics in you, do you export what you lack?
Honestly, like I told you, we don't lack nurses. What we lack is equitable distribution of what we have in the system.
So do you export what you are suffering iniquities with its distribution in Ghana? You have like how many?
Honorable Chair, it also has its own advantages as well.
Do that. There are no nurses, and yet government says that I'm not able to recruit them because of the very reasons you gave earlier, lack of financial clearance. So I just want you to reconcile eminent shortages in Ghana against gains of exports.
Honorable Chair, this is serious economic benefit analysis in economics. But we have seen times in our country where we didn't have nurses in hospitals, but about 3 cohorts were sitting home without jobs. So how do you explain that too? So we need to do a little bit of adventure. I mean, we can't continue to do the same thing over and over and over again. So as we try to explore what further advantages we can take, opportunities we can take advantage of, we try to realign here to see that we don't create unnecessary challenges to allow our young people to continue to sit at home with our jobs. That is what I'm trying to explain. And I believe this is good, how do I call it, policy that we may pursue, but with a lot of caution. And I keep on stressing that we do such that will not harm our system at all.
Honorable nominee, it has come to my attention that the main oxygen plant at Kolebu has been dysfunctional for quite some time, even in the face of the COVID pandemic, which relies heavily in terms of its treatment on the use of oxygen. Now, the breakdown of that equipment has undoubtedly resulted in the shortage of oxygen in some treatment centers. Additionally, the sterilization plant at Kolebu Teaching Hospital has also been down for quite some time. The effect of the breakdown of the sterilization equipment is that very critical surgeries have had to be postponed by several months, resulting in needless deaths. Are you aware about this situation at the premier teaching hospital of our country?
Thank you, Mr. Chair. This has come to my notice, and I called the Kolebu Chief Executive yesterday. He's given a briefing, and we are finding some support for them to try to see how quickly they can rectify these challenges.
I'd like to find out from you whether you buy into the suggestion that certain departments at the teaching hospitals in our country, such as the neurosurgery department, the urology department, etc., should be granted semi-autonomous status, like the cardiothoracic center, to enhance efficiency in the operation of the teaching hospitals, as opposed to the centralized manner in which some of those departments currently operate.
We are studying the feasibility of that sort of autonomy, and I believe it's something that is workable, because centers of excellence are workable in Kolebu.
Lastly,
you have exhausted your questions.
this is a follow-up.
You yourself,
No,
lastly, very well.
Yes.
Let me save time.
Yes, this is a follow-up to an earlier question asked, and it has to do with human resource development at your ministry. I have been informed that about 113 doctors of medical laboratory science, and my colleague, Honorable Nivan Dapoy, asked you a series of questions bordering on a medical laboratory science. These doctors have qualified and are waiting to undergo the mandatory housemanship. But
Honorable Agaga, please, was that doctors of medical laboratory what?
Science, laboratory science.
So they are laboratory scientists. Yes. We want to be clear, because on this table we're talking about doctors, talking about nurses. So they are medical laboratory technicians or scientists.
Mr. Chairman, these days they also prefer to be called doctors, and so their designation is as such. The title is MLSD. The D stands for Doctor of Medical Laboratory Science.
Well, that's a degree.
Yes.
It's just like having a PhD in law.
Yes.
Yes, but so that will make you a judge.
Mr. Speaker, when they write correspondence, they use the title doctor.
But I want us to differentiate between the medical doctor, as in physician or surgeon, or, you know, that's all the difference I wanted to be clear about. So please proceed.
Honorable Chair, the clarification is that lawyers can become doctors in law, philosophers, economists. So we use the title doctor. So medical laboratory scientists have also advanced their education, and they are graduating with PhDs. So when they have PhDs, that does not necessarily make them medical officers who are normally called doctors. The pharmacists are now using the PhD Farm D. So that is how the professions are developing.
Now, this group of professionals have been pursuing your office for assistance to get clearance in order to undertake the mandatory housemanship. What is the position, Honorable Nominee?
I'll have to check on this matter. The various professions are recruited based on vacancies. Some of them are recruited as a cohort after passing the professional exams. So I will check and find out why they are still sitting back and see how best we can get close to them. Tell you, when we are joined, we have recruited quite a lot of them. They themselves are aware. That is the numbers that I was talking about. So we are working.
Very well. Yes, is it Gisela? Yes, you have a question, please go ahead.
Thank you, Mr. Chairman. Congratulations to the nominee as he's being rolled over. I think we can describe it as that. Honorable, what is your, with the advent of COVID and the need to have a regime of preventive health care, a bit much more stronger than we had before, what is going to be your plan going forward on health and wellness for the Ghanaian citizenry?
That is an area we are now highlighting in the ministry. We have done the Universal Health Coverage Achievement Roadmap, and we have actually highlighted fitness and wellness issues. We will soon launch our non-communicable diseases policy, and you see how we have actually given that importance and significance to that area in health. So when we begin to roll out and implement the newly done national non-communicable diseases policy, you will see how we are going to tackle that area.
Thank you, Mr. Chairman. This is a follow-up question. Don't you think that we are racing against time? Because we all know that the immunity boosters that are needed for COVID, there's a lot of talk about using steam, neem tree, steaming fruits, vegetables, and so on and so forth. Don't you think that we should have been doing this at the advent of COVID in March last year, or at least that should have been highly accelerated by now to avoid some people getting into a bit more distress than happens?
If you have been following our COVID education programs, you realize that we continue highlighting exercising and physical fitness. We have instructions to all health facilities to create wellness and fitness centers, even at the district hospitals. And we encourage Keep Fit clubs. I have joined some of them to climb the Abreu Hill on 2 occasions. Yes, I did some 15. I can walk very well. Yes. You know, so it's encouraged. We meet with they have a coalition of Keep Fit clubs in the country. They do their annual programs. I join them. So we are doing these things, only that is on a very smaller scale. GIZ has actually helped us to also develop a plan that will enhance developing this area. So like I said, it's a comprehensive package will come out to roll out. But that doesn't mean that we are not doing anything in that area at all.
Thank you, Thank you, Honorable.
Honorable Minister, nominee and honorable members, please be advised that our center is open. So members who want to join Parliament's Keep Fit can join it. The instructor has just opened the platform and is adding members. So I invite all who wish to join in.
Thank you very much. Honorable nominee, I think I'm trying to emphasize the fact that it should be, you are indicating that if I've been following your programs, I think that there should be a bit more to be done about it. And that is what we are advising you to do, because we speak from the districts, from the villages, and so on and so forth. And no, that kind of education is not going on there. NCCA is literally begging for money for fuel to go around with their vehicle. So we know we are racing against time with the COVID. And I would plead with you that you take some advice that we should speed up with some of these things. You can have all your comprehensive plans on paper, but if in reality people are not getting the information ahead of time, some deaths could be preventable, and it may be a bit more, to move with a bit more speed. That would help.
Thank you. I've taken note of that, Honorable Chair.
Thank you. My next question has to do with infrastructure, especially moving from health center status to polyclinic status. In my constituency, the town of Bojuasi, with a voter population of over 18,000, we had a health center which has been upgraded in quotation marks to a polyclinic. But the facilities there will not really, if you really have an inspection of them, you think that they are not really up to the polyclinic status. Be that as it may, there are 2 doctors there, 2 doctors who have been posted there. So with a voter population of 86,000, we have only 2 doctors, 2 medical doctors. That said, I would like to know what is the policy direction for supporting infrastructure from the health center stage to polyclinic, and who has to fund that? And I'm saying this because there have been lots of appeal for funds just to be able to construct an emergency center and more administrative space for that facility. And I think that sometimes our appeals, I'm surprised that our appeals have to be made that way. I believe that they should have been made from the allocations made from the ministry or so. So I would like to know what is the policy direction on that. Thank you.
Allocations made from the ministry, that is correct. But where allocations are not coming, they're not adequate. Citizenry are also employed, encouraged to support. Some of us MPs have used our health fund to do clinics in our various constituencies. I said some of us, because others use for other things. This has set up a fence, but it's the state's responsibility. But when it's not forthcoming, we see how best communities and things do. Some communities start their own clinics even before we put in health centers. But you have 2 doctors. That is why your chief compound has been upgraded to a health center. You have a health center, we have been upgraded to a polyclinic. Most health centers don't have doctors, and you have 2. So yours is a peculiar, specific area. Let us see what is not there, and let us see what we can do for that area over the next 3 or 4 years. I'm not maybe even surprised if we won't find your constituency or your districts in the 101. I'll have to check on that one.
My constituency is supposed to be in 101. We are waiting. The land is ready.
I mean the 101.
Yes,
if it's there,
we are in there.
So
we are in there. So we are ever waiting for you to come and cut the sword.
Thank you.
In Autu. Thank you very much. My last question goes to, on February 1st, there was a news article about the mortuary workers saying that they believe that the numbers for COVID were not being reported accurately. Their roles are already risky, even in the traditional sense of the word. And now with the advent of COVID, what plans do you have for Mortuary Workers Association?
We are in the process of establishing the Mortuaries and Funerals Act. This was passed some years back. We only picked it last year to try and establish it so that they have an agency that takes care of their welfare and several other things. We have been engaging with their consultant, and I believe going forward we have a program that will help them get some of their challenges resolved.
And then the next question. The sickle cell unit at Kolebu has a database of over 30,000 patients. They see on the average 10,000 patients a year, averagely maybe 50 a day. But it's 45 years old. Over the past 4 years, what intervention did you make in that facility? And what are they going to do moving forward in case you do not make any intervention? Thank you.
Specifically for Kolebu on sickle cell, over the last 4 years, we haven't had any significant investments in that area. But we're now engaging with Clinton Foundation. They are coming to do some massive sickle cell program in the country, and I believe Kolebu will be covered.
Thank you very much, Honorable.
I have a follow-up question.
Sorry?
Just one last follow-up question, please.
Oh, you have had one too many.
Yes, they were very short. Thank you very much. Thank you. In our communities, Honorable Nominee, in our communities, we hear a lot of adverts on information centers being played. usually at dawn or in the evening around 6, thereabout p.m. And they're often trying to sell or advertise one medicine or another for a lot of ailments. What is the public health plan for that sector? Because it is very, when I listen to some of the adverts, if I didn't have an idea, a little idea, I could be a bit confused about what to buy and what not to buy, because they are very convincing. What steps are you going to take to be able to support and protect the vulnerable in society who listen to all these adverts? I think those on the buses are equally part of that. What steps are you taking to protect those vulnerable groups, to at least know that, or what kind of public health plan do you have in place for that? Because it is a bit one too many. There's a proliferation of information centers. Yes, they're able to earn some money by doing those kind of advertisements, but they market a lot and sell a lot of drugs. Under whose control? Thank you.
We have health committees in all districts. They are supposed to help us fight this sort of battle. The FDA has surveillance activities in the districts as well. And probably what we will do is that we will have to admonish and encourage them to work harder and report some of these matters for investigations. I think going forward, now that we're noticing some of these challenges, we will tackle them head on. And I would say, can I crave your indulgence to stretch a little bit?
Yes, please.
Because at my age, medicine, I shouldn't sit down for more than 3 hours.
Yes.
To try to avoid prostrate disorders, but you wouldn't listen to advice.
We will take your advice.
And particularly that your wife is supporting you from behind.
So I'll allow you just 5 minutes, or is it sufficient? Very well.